Small cell lung cancer is a genomically unstable, fast-growing, and aggressive form of cancer, representing approximately 15% of all lung cancer cases. Typically, it affects patients with long history of tobacco smoking. So the main way to prevent this disease is to stop smoking. In the past 3 decades, there has been no major improvement for treatment of small cell lung cancer due to its outstanding ability to develop drug resistance. During first rounds of treatment, good response is usually observed where the tumor size substantially shrinks. Unfortunately, the tumor develops resistance early on, and relapse occurs within a few months. Due to this aggressive nature, the median patient survival is very short, only 10 to 12 months long. One of our major goals is to understand what genetic changes affect drug resistance, which may be used to identify novel drug targets to improve treatment. Small cell lung cancer has 2 main subtypes. The larger subtype is called the neuroendocrine subtype, which is characterized by high expression of neuroendocrine markers such as chromogranin A and synaptophysin. The other subtype is a non-neuroendocrine subtype, where we observe elevated Notch pathway activity and no neuroendocrine markers. During the development and early states of small cell lung cancer, the cells are almost exclusively neuroendocrine in phenotype, which over time gradually transition to the non-neuroendocrine differentiation. This transition process is further accelerated by the implemented chemotherapy treatments, where the emerging non-neuroendocrine cells are associated with resistance to treatment. Understanding the genetic and epigenetic landscape that modulates this evolutionary process could help us identify targets that could, for example, be used to keep cells in a drug-sensitive state, leading to a substantial increase in survival rates. Small cell lung cancer is primarily localized in the lung, but unfortunately it spreads rapidly, with metastases appearing in early time points. For this reason, surgery in most cases is not very effective. Because of the lack of surgeries and small sample sizes, obtaining tumor material which will be useful for diagnostics and research purposes is very challenging. This is probably one of the main reasons why small cell lung cancer is rarely included in larger cancer studies. Nowadays, there has been more attention towards plasma-based genomic profiling of tumors, which circumvents invasive tumor sampling since only a blood sample is needed. These methods have been used to find DNA mutations and copy number alterations, useful for diagnostics in several cancer types. Recent advances have enabled researchers to perform genome-wide profiling of epigenetic changes such as DNA methylation and histomodifications, which are key regulators of the genome affecting gene expression and development. We aim to use these novel methods to help improve diagnostics of small cell lung cancer patients, avoiding strenuous tumor samplings, hoping to improve overall patient care.